Hello everybody, it's Dr. David Brady here, and it's been a while since I sent out a video, and I don't have anything really formal prepared. I just wanted to talk a little bit about an aspect of the COVID-19 pandemic, probably one that doesn't get enough attention. Most of the attention, and understandably so, is directed toward the people who are acutely ill and have respiratory distress syndrome and are, potentially going to have a very bad outcome or even lose their life. And for those who have succumbed to this terrible virus, certainly condolences to their families. The system is getting better at dealing with the acutely ill. However, there's a whole nother group of people who are really suffering, and they're known as the COVID long haulers. And COVID long haul syndrome, as the name implies, is basically where people may recover, and they recover from the acute symptoms that they may have from having the SARS-CoV-2 virus, but their symptoms don't fully go away, and they're left with a persistent palette of symptoms, which is very consistent from patient to patient. And this is really common. In fact, many of you may remember in Italy, in Bergamo, for instance, where a significant number or percentage of the population was infected with SARS-CoV-2 and went on to develop clinical COVID-19. And in a large study done by following up all of the people who had been hospitalized in Bergamo, it turned out that over 50% of that group of people were still suffering months and months later from significant life-altering symptoms. And we see that going on broadly across the world, certainly here in the United States. I have many, many patients who are dealing with long haul syndrome. In fact, my lovely wife is dealing with long haul syndrome. Her history was interesting. Back in March, she came down with a lot of acute respiratory symptoms. Luckily, having access to what I have access to and knowing what I know and having the resources in my practice to pull home, basically, things like home oxygen and intravenous vitamin C and hemolumin and blood ozone treatments and everything else, we were able to keep her from having to go to the hospital or be in any kind of acute medical environment. So she did recover from those respiratory things, although she never had a positive test. And I tested her in multiple ways, multiple times. I collected the NP swabs myself. She was never positive. And she never developed significant antibodies. But her symptoms were such that nothing else explains the things she was having. She had never had these things before. She was extremely healthy and fit person. And so she was left, though, with these ongoing, lingering symptoms, which are hallmarks of COVID long haul syndrome. And that includes intermittent, rapid heartbeat, known as tachycardia, and the feeling that your heart's beating out of control, like a palpitation type of thing, and feeling like it's erratic in the way it's beating. Even though when you test it, we've used Holter monitors, I've had her have full cardiac workups and echocardiograms and stress tests and the like, and really nothing pathological shows up at all. And that's what the cardiologists are saying. These people are definitely having this sensation and these symptoms of tachycardia and feeling that their heart is beating out of control, getting very easily fatigued, and having also lots of joint pain and body aches. Pain that seems sort of inflammatory autoimmune in its symptom presentation. So a predominance of pain in the small joints of the hands, so hands, fingers, wrists. Also pain around the rib cage is another thing a lot of people complain of. And my wife even had, she doesn't have it anymore, but for a while she was having those hallmark electrical feeling, kind of a buzzing feeling in her body, which is very strange, very unique to SARS-CoV-2, just as the loss of taste and smell is, even though she never had that. So She's very much in contact with a lot of people in support groups for long haul. So she's very attuned to what other people's experiences are. So I've learned from that as well. Learned not only what that symptom pattern is like, but what people have been doing that has seemed to help them, what people have been trying to do that doesn't seem to help them. So right now, what I've been using a lot with patients, and indeed with my wife as well, are some key things to help the energy biochemistry and respiration in the body, in the mitochondria and all the cells. It seems that there is a breakdown in energy production, particularly in pathways involving something called NAD+. So we are using NAD+ precursors like nicotinamide riboside, or NR, also another form, NMN. You'll see this in some of the products. So those things can be really helpful for mitochondrial function, along with other well-known energy or mitochondrial nutrients such as coenzyme Q10. We're using ribose, and these can be very, very helpful. CoQ10 is also really good for the heart, for the myocardium or the muscle of the heart, and also for the rhythm or the beating of the heart. So CoQ10 is really, really essential. Once in a while, when she starts having respiratory symptoms, a little shortness of breath or a little lung irritation, we use nebulized glutathione and also oral glutathione as well. And we've been using lately a peptide known as Thymus Alpha. And Thymus Alpha is a prescription peptide, so it's a functional protein that has been used previously mainly in autoimmune conditions and in immune dysregulatory symptoms. So it can talk to the immune system and basically get it back on the right track. So it's not going too heavily on one side of the immune function or another. So it'll balance out what we call Th1, Th2 function, and basically quell the immune system's hyper response. There is a lot of hypotheses on long haul, what's going on. Most argue that it's not active infection with the virus, but it's sort of a reprogrammed immune response that occurred because of exposure and initial reaction to the virus. This includes changing cytokine patterns and changing just the sort of set point of the immune system itself. And it pushes the person into a more aggressive immune stance, more aggressive inflammatory cytokine picture. And there's some that have speculated, and I wouldn't be surprised if this is actually true, that the virus itself, through what we call molecular mimicry, has created autoimmune attacks against specific tissues in the body. We know that it has an affinity to attack heart muscle, for instance, and in some people, you even see physical or physiological changes in the myocardium. So it makes sense that Thymus Alpha may help. So if you are a long haul sufferer, these are just some things I offer to you, not as a direct suggestion on what to take or what to do. You really need to work with a doctor, with a healthcare provider, but these are just offered as some suggestions for discussion with your provider to talk about these things as options and to explore, because they very well may help you. And I would also strongly encourage you to get involved in some of the online groups with long haulers. You can learn from one another, and you won't feel quite as isolated in your experience. But today's video basically was just a shout out to the long haulers, to give you acknowledgement and recognition, and know that many of us out here in the medical and health fields are doing everything we can to try to figure this out and to try to find viable ways to make your experience better, and hopefully come up with a solution to correct the problem over time. So any of you suffering, we're thinking of you. And for everyone else, we're in this crazy time still all together. This year's coming to a close, and hopefully the next year will be a better one. And I wish everyone a wonderful holiday season, whatever your traditions are. Hopefully it involves some peace, and with within all the safety, public health parameters that you should be acknowledging. Get some time with your family. And that's it for me, and hope to talk to you again soon. Bye-bye.